Oh, that's pretty fast.
Okay.
The 3 stages of labor. Labor is a process that can last many days or even weeks before the actual birth of the baby occurs. This can be a very frightening time for soon-to-be mothers. First-time moms often wonder if they are actually in labor and find themselves visiting the doctor or calling the labor unit to ask if what they are feeling is normal. There are 3 stages of labor that occur with a normal vaginal delivery. The first stage is very important. This is when the cervix will dilate up to 10 centimeters. The expectant mother is often encouraged to walk and be active in the end of her pregnancy to bring about real contractions. Unlike Braxton Hicks contractions or practice contractions, real contractions will not go away with rest and drinking plenty of water. Activities like walking often help stimulate labor or keep contractions coming frequently enough for the pregnant woman to start making adequate cervical change. There are actually 3 phases within the first stage of labor. According to Bennington, these phases are known as the early phase, the active phase, and the transitional phase. The early or latent part of the first phase can last a very long time and is usually the least painful part of labor. The cervix will generally dilate to 3 or 4 centimeters in the early phase. The next part of the first phase is referred to as active. The cervix will usually dilate to 7 centimeters in this time frame, with more intensity as contractions will be coming closer together. The final part of the first phase is the transitional phase. This phase takes more energy as the contractions can be a minute apart and the mother will not be able to relax at all. There might be some pressure or an urge to push at this time. The dilation of the cervix will go to 10 centimeters during this last phase of the first stage. The second stage of labor takes a lot of effort on the part of the mom. The baby is moving down the birth canal at this time. The baby has to move down past the pubic bone during this stage, which can be very difficult. The mother has to push the baby out, though she is greatly assisted by the contractions of her uterus. The uterus will often assist the baby to move down the birth canal, even when the mother is unable to push effectively. The most effective way to get the baby out is when contractions or pushing are grouped together. Ellen states this stage is generally when most problems can occur, as the infant's head is being compressed and can cause the baby's heart rate to dip a significant amount. Pushing for a long time can also cause the baby's head to have some molding or lengthening of the skull. Conversely, pushing for a short time can cause swelling and bruising of the infant's face. This stage will end with the complete expulsion of the infant from the uterus and birth canal. The third stage of labor is the time from the birth to the expulsion of the placenta. At this time, the attending provider will often assist the placenta out by gently pulling on the remnant of the umbilical cord, which should have been cut after the birth of the infant. Force should not be used, as this could cause more bleeding and discomfort for the mother. The mother may need help to push out the placenta at this time with small, gentle pushes. This stage of pushing is usually much easier on the mother as they are focused on the infant that they are now able to hold. The process of birth is not the same for everyone. There may be variations in the length of time between all of these stages. There may also be different levels of intensity and pain with contractions or pushing. Mothers with multiple children may be dilated to 4 centimeters for several weeks before giving birth. The entirety of labor may only last a few hours for some. There are almost always many differences in each labor, but one thing is sure: birth is a process that can be amazing and life-changing.